give us an overview of your initial, how you found out you had mouth cancer. If Rachel, you'd like to go first.
So mine really was a lump on the inside of my right cheek, which I found on Boxing Day 2007, and it just didn't go away really, and it wasn't until going backwards and forwards to dentists that it wasn't really picked up, and my dentist reluctantly referred me to the hospital. And then I went to see my consultant, only because my GP then referred me. I went to the hospital and had the biopsy. And that was that. That was in the August of 2008. So it was quite a long journey of this ulcer that just continued to get bigger, me biting it. And it wasn't particularly a nice thing to even look at. So like I say, I went to the doctor's on the Monday morning, had an appointment on the Monday afternoon, a phone call on the Monday afternoon from the hospital to say, can I get there on the Thursday? I thought, wow, that's pretty quick. Went on the Thursday, had a look and said, yeah, we need to do a biopsy on this. It'll have to be done on Monday. So, it was quite, from the very first start of it was very, very slow. And then all of a sudden it was quite quick. So I went back on the Monday and had the biopsy taken. And, 2 weeks, appointment was made for 2 weeks. And I thought, well, you know what, if nothing's come back, if they'd found something, it would have got me in sooner. And then the night before I'd gone to bed, wasn't asleep. And I just had this premonition of what the following day was going to entail. Where I was, my premonition was I was going to meet my friend. Just happened to who was working at the hospital. I was going with my mum. We went for coffee, went into the waiting room, and so that's what I'd actually seen the night before, although I wasn't asleep. And it's a bit like a previous deja vu or something like that. And then the following day I had to get up, and my husband used to run a youth group for young firefighters. So a couple of weeks to go, we were going to be taking approximately 100 odd children to Bournemouth for a week. That was fun. So he'd gone off out to go and get the food for that week. And so I was looking after my children. I got 5 small children at the time, age ranging from 11 to 1. And this letter came saying I need to go for a CT scan that day, that morning. And so I phoned them and said, look, I'm really sorry. I've only just received the letter. I'm not going to be able to get there this morning. However, I've got my appointment to see my consultant in the afternoon. So she said, yeah, that's fine. Come this afternoon. So with that, I phoned him. I said, look, you need to come home. I need to get to the hospital now. And he's like, yeah, I'll be home shortly then. So then my 11-year-old son, he comes down and said, Mum, why do you have to go to hospital sooner for? And I just said, I think I've got cancer. So with that, I waited for Tim to come home, and I continually waited for Tim to come home. And I continually waited for Tim to come home. So by the time Tim had actually finally come home, I was quite up here with stress. So literally barged out of the house, went and picked my mum up, drove to the hospital, walked towards the hospital door, and lo and behold, there's my friend who I'd seen the night before in my premonition. We went for coffee, basically everything that I'd seen the night before. Went into the waiting room. My friend said to me, you'll be fine. Everything will work out fine, Rachel. Nothing's, there's nothing bad. She then left me. Me and Mum walked to the waiting room, and the nurse came out, called me in, and I sat down, and the consultant said, we've got your results. And I just said, it's cancer. And he said, yes. So with that, my mum just broke down. Myself, it was just like, thank God somebody can finally tell me what is wrong with my mouth, because it was so sore. It was just horrible. So he explained that they would do a neck dissection, which is basically cutting from the ear all the way round, giving you a radial forearm flap, which is basically taking flesh out of your left arm or right arm, whichever, and the main vein, taking the cheek out, throwing that away, putting the arm into your mouth, and then taking skin off your tummy to put onto your arm. So it was quite a lot to take in. And when you hear the word cancer, you just basically shut down anyway. So it just sort of went in one ear and out the other. So with that, I came out, and the nurse, my cancer nurse who was assigned to me, she used to be my orthodontist nurse when I was 16. And so I said to her, Kim, am I going to die? And bearing in mind, I've got 5 small children. So, sorry, that bit always gets me. And she said she couldn't answer that question. So that was probably my lowest time, knowing I got cancer and my 5 children. So I went off and had my CT scans, and had my x-rays, and then came out, phoned him, and because he'd annoyed me, I just said, he answered the phone, and I said, I've got cancer, bye. Literally, just like that. How, hindsight is a powerful thing. And you just, now I think, God, that was quite heartless. That was really heartless. So I dropped my mum home and got home, and Tim was there with the 5 children. Now, Jake, he was 11. Esme, she was 7. Cavan, he was 5. Them 3 understood that I was poorly. The other 2 were just too little. So what we did, we decided we'd tell the children that my neck dissection was going to be a shark attack. My arm was a bear, and my tummy was a jellyfish. So they were fine with that then. We had to do it as a playful thing, really. And then on the 5th of September 2008, I went in, and on the 6th of September 2008, I had surgery for 9.5 hours. I was quite fortunate. I had my children to get me going and get me out of the hospital. So I was only in for 6 days. The first few days were quite a horrendous time, as Graeme will probably know. And my husband was like, obviously didn't know what I was going to look like. I was told I might never smile. And my husband said to me, do you want to have a look in the mirror? Not really, no. Go and have a look in the mirror. No, I don't really want to look in the mirror. And he insisted, so I was like, okay. And there was this beautiful photo of Kylie Minogue. I love Kylie Minogue. And so that was my mirror image was Kylie Minogue. And that's like, that sort of really made my day. And then I was able to get around and go into my ensuite bathroom in the hospital. And there was another beautiful photo of the beautiful Kylie Minogue. And then I just thought I'd need to know if I can smile. So I just peeled a little bit back, and slowly I was able to see I could smile. And that made me feel really good that actually I hadn't lost my smile. And then I went home, and then for that first year, it was absolutely horrendous, going backwards and forwards into hospital, having to have some of the flap, which is what they call that inside, removed, infection. It was horrendous. I don't know how I managed it. I don't know how my husband managed it, looking after me and the kids and having to go to work. But he did, up until there was a time where he couldn't cope anymore, and our marriage sort of like cancer nearly destroyed my marriage, because I felt that he wouldn't talk to me and I couldn't talk to him because I didn't really want him to be upset. So our marriage was sort of like splitting, was drifting. And then this one day he said, I can't do this. I'm going to call the minister who married us. And he sat us down And he said, what is the issue? And I said, well, he doesn't care. He's never cared. He hasn't bothered looking after me. And he said, so what's your problem then, Tim? And he said, I feel hopeless. I'm a fireman. I help people, when they really, really need it, but I can't help my own wife. And so that was the part where it was just, oh my gosh, cancer didn't just affect me. It affected my husband and my children. And I do remember saying to Tim one time, it's all right for you. You haven't got cancer. But actually, no, he didn't. But he lived with it. And now, I do lots of raising awareness of head and neck cancers because I don't want others to go through what I went through, where I felt I was on my own. There was, 13 years ago, there wasn't very much about head and neck cancers. Or if there was, it was horrific photographs that you'd see online. Now there's lots of, support groups out there for head and neck patients and also their carers, because the carers are the lost ones. And like I say, since then, this is why I've been doing the raise and awareness of head and neck cancers.
Thank you, Rachel. That was very moving. Graeme, I understand. I understand we might be pressed for time. Do you want to, just give us a sort of an overview of how you found out, but also, just that sort of, had you been aware of mouth cancer before, kind of thing, or was it something that was very much took you by surprise, because you perhaps didn't know what it exactly was?
Yeah, well, there's quite a lot there that I can relate with Rachel's story. My story starts with what I thought was an innocent ulcer on my tongue in January 2020. And where it was actually on the side of my tongue, and every time I spoke or every time I ate something, it clashed with my teeth. So it was quite painful. And after a few days, I thought, well, I've had enough of this. So I went to the pharmacy and got some over-the-counter gel, thinking, well, this will clear up shortly. But it didn't. So I went back and tried every other kind of treatment over the counter I could use, but still to no avail. And of course, this was getting more and more painful. So in the end, I went to the doctor, and the doctor had a look at me and said, well, have you bit your tongue recently? I don't think it's too much to worry about. It didn't give me any pain relief, which is something I really wanted, because it had been that detrimental by this stage. But he did say to me, if it doesn't clear up in a couple of weeks, go to the dentist. And I thought, right, okay, well, I'll have to bear it for another couple of weeks then. So off I went to the dentist, and the dentist didn't say anything to me per se, but he was quite on the ball, because he took a photo on his phone and sent it along with a request for a consultation appointment at Russell's Hall Hospital. And he gave me some antibiotics, and I thought, right, finally, I've got some strong meds here. This will clear it up. But of course, it didn't. And by this stage, I was becoming more anxious and worrying about this and that, and rightly or wrongly, was Googling everything about symptoms and duration and things. But there's something I resonate with Rachel there, that there was something quite instinctive, and it's not logical, but one can almost, that there's a serious problem. And I knew I had a really profound feeling of what I can only describe as doom, to be honest. It was very overwhelming. And consequently, by the time I had my first consultation appointment, the consultant looked at me and said, you can't speak, can you? He said, what do you think that is? And I said, it's cancer. And he said, I think it is too. And he brought in the support staff, because obviously he was going to break this news to me, although really it was a confirmation. And I remember looking at my wife, because I was more worried about her at the time and how she'd accept it. And it was a big blow. I left the hospital really feeling disconnected and otherworldly, as if I can't quite believe I've been told this, because I packed up smoking 20 years ago, drank very little, really, compared to friends and family, led a very boring lifestyle, and thought, well, how on earth have I got this? But, I had, suspected confirmation, and then following the subsequent investigation there and biopsy, it was confirmed. But this went on so many weeks that I really couldn't eat without coating something on my, what now I understand was the tumour. And it was, I remember particularly at Easter, for example, I couldn't even eat a bit of chocolate without it stinging. It was so painful. And I had to sleep to order to get any amount of hours sleep. I had to sleep with a clean flannel, half in, half out my mouth, to stop this thing catching my tongue. It was that painful. That's how I found out. It was a mixture of feelings. One, and it's something I still can't accept today because nobody can tell me why I got it. So to answer your question, no, I hadn't thought of mouth cancer, to be honest. So do you want me to go into treatment, or we push for time?
I think did whoever's organised say that they've got another one about now?
Possibly. I think. I'm happy to answer whatever you want. So
sure. I just don't want to make. If there's anyone else waiting, I don't want to make them like just on. I suppose because we've heard a lot about the treatment, but I just suppose what do you think? Just words of advice for people who like yourself haven't thought about it. What to keep an eye out for, and when should someone be going to the doctor for something like a mouth ulcer or whatever.
Well, the simple honest answer is as soon as possible. The Mouth Cancer Foundation does a lot of work stressing that people should regularly inspect themselves, which I suppose in one way I consider myself lucky because my problem was visible. Unlike some cancers where it doesn't become apparent until much later. I could see mine, and obviously it was causing problems straight away. So so if there's anything like a lump anywhere or anything like that, the discoloration that isn't going away, get on, stay on the ball and go and seek treatment, because the sooner you do that, even though you might have, confirmation that you don't want to hear, the sooner you can get treated for it.
Rachel, thank you very much for your time this morning. It's been quite moving to hear both of your stories.
Thank you.
And